Welcome to the Elements of Science. I'm Abigail from Research and Knowledge Exchange at the Mind Foundation, and today's topic is harm reduction in psychedelic studies. You may have heard that psychedelics are capable of causing bad trips, and yet they're being successfully used in clinical trials. This video will show you how scientists minimize the risk of someone having a bad trip, particularly one that has any lasting negative effects. Safe administration is a unique task with psychedelics because although they're physically very safe, their psychological effects can vary a lot. But thankfully, the adverse effects are not random. Scientists have gotten pretty good at preventing adverse experiences in their studies, and their number one rule is that some people, some of the time, should probably not take psychedelics. People who have certain psychiatric disorders or a family history of them may be at an elevated risk for long-term negative effects, so study participants are always screened for schizophrenia, bipolar disorder, and the like. Certain medications can also interact badly with psychedelics and should not be combined with them, and psychedelics moderately raise heart rate and blood pressure, so people with heart problems should be extra careful. Rule number 2 is to have a trained trip sitter. In fact, most studies always have 2 trained counselors in the room. If the person who's tripping is the pilot of their experience, these 2 are the flight attendants. They ensure comfort, but primarily safety. Trip sitters should be knowledgeable about potential adverse effects, as well as compassionate, friendly, and respectful. They should also develop a relationship with the participant before the trip to ensure that there's a solid level of trust. Rule number 3 is to have a safe and comfortable setting for the experience, like this one. It's a comfy living room. The area should be free from distractions, like cell phones, as well as dangerous objects, like candles or sharp corners. And distractions can also be eliminated using headphones and an eye mask. Lastly, the participant should have visited the room before. It should be familiar to them. Rule number 4 is that the participants should be prepared for the experience, but also open to it. Volunteers in studies are always informed in detail about what they might expect from their trip, and they're coached on how to handle difficult experiences. They're encouraged to mentally surrender to the experience and to trust and be open. If they get anxious during the trip, this instruction is repeated. It often helps to calm them down. And the person is also reassured that they're in a study, they've taken a drug, and they will return to normal in a few hours. Holding their hand can also be very powerful. And although it's rare that they're needed, psychedelic laboratories keep medical doctors and anti-anxiety medication on hand as a last resort. The final rule is integration, which translates the psychedelic experience into real changes in thought and behavior. It can take some time for people to really digest psychedelic experiences, and especially if the person had a challenging experience, integration can help resolve it into something positive and meaningful. Having someone to talk to, like a trained counselor, is an invaluable part of this process, and that person can also look out for signs of persisting effects, particularly negative ones. Thankfully, in the controlled environment of psychedelic studies, these are so far extremely rare, but it's the responsibility of the researchers to watch out for them, because when it comes to psychedelic research, safety is taken very seriously. Psychedelics are powerful tools, but like any other powerful tool, they have to be wielded with caution and responsibility. Only then do they have a real future in mental health care. For more details on safety in psychedelic studies, you can check out the Drug Science program or refer to this top paper, Human Hallucinogen Research, Guidelines for Safety. See you next time on Elements of Science.